Dr. Kinney, what's your kid's name? Emmy? Shayla. Okay, thanks for coming out. Our topic we're going to talk about is equine pasture management, specifically for parasites. So, excuse me. So, the only two options we really have for parasite management in horses is dewormers and pasture management. Do you two have horses? Do you do regular dewormings or what? You have protocols?
Not really regular.
Okay, just helping the rest of stuff? Okay, well, that's why I'm glad you're here, okay? So let's just kind of cover what the agenda will be. We'll just kind of cover some parasite basics, okay? Types of parasites. And then we'll talk about dewormers a little bit. And then we'll talk about the management, what we can do in the pasture to manage it, okay? Do you ladies have pastures that you graze your horses in? Or just, they're just doing dry rock? Okay. And there's things we can do there, but, yeah. Okay. So, there are 6 general types of intestinal parasites we worry about in horses. Okay. And basically the way they get infected for most of them, or kind of almost all of them, is the horses pass eggs in their feces. Those eggs hatch in the environment, and they turn into little larvae, and then the larvae crawl up on grass blades, and then the horse grazes and eats the grass blades. And then the larvae gets inside the adult. And different parasites do different things, but in a nutshell, they get into the adult, they migrate, do some maturing, and then they turn into the adult stage again, which is kind of where they vary a little bit. Most of them end up in the intestinal tract. And then they start the whole cycle, they have eggs, they shed their feces, and such.
So it's easier for them to get into the grass pasture and the dry water?
So,
is it better environment for the water?
yeah, so it can be just because, well, I don't know that there's more risk per se. Okay? I think it just has to do with how the horse eats and grazes. And so I could probably assume, like maybe if you fed hay and a feeder off the ground, they'd probably be less likely or less at risk. Okay? I think horses that are probably grazing. But really, and we'll talk about it, but really all horses have parasites. And we can never, it's unrealistic to have a horse that has no parasites. Okay, and we'll talk about some foods and reasons why. So let's go through the common parasites, okay, the 6 groups, okay? So, and then I found these little articles. We could post them on our page if people want to read them. They come from Penn State, so they're good articles. So the first one is called the large strong dial, and that's the parasite that's probably the most concerning, because what that parasite does is it, when it gets into the body, before it turns into an adult, it migrates through all the tissues. It can migrate through the liver, the spleen, all kinds of organs, until what it wants to do is find a blood vessel and live inside a blood vessel. And there's some specific blood vessels it kind of likes to target, but what that does is it causes blood clots. I mean, the horse has a blood clot and has a blood clot. Those are the most, that's the parasite that causes the most damage to horses, because it's pretty much life-threatening. The other type is called a small strongyle. So those ones, what they do is they get into, after they migrate, they get into the intestinal tract, and they can create those cysts into the side of the intestinal wall. And they're kind of hard to get dewormer, because they go into like a dormant state, where they get cysted in them and they kind of get stuck. And they can be in that state for 2 years. What's bad about them is if we get lots and lots and lots of cysts, which is kind of the interesting thing, which veterinary medicine hasn't really figured out yet, but there's some certain triggers that happen that cause them to hatch out of those cysts. And so you could have hundreds or thousands of them hatch all at the same time, and then our horses like get some bloated diarrhea. So those ones are a little bit challenging. Okay? There's lots more information in here about them. I'm just going to do the basics. The third one's called aspirates. So these are the ones that we refer to as roundworms sometimes, or most commonly like foals instead of worms. This is the one we're talking about, aspirates. And foals are the most susceptible to those. Usually as horses kind of age, they develop some resiliency to aspirates. So foals are the most susceptible. And the problem with that is they get such heavy worm burdens, or the infection count is so high, it can cause a colic problem where the intestine gets blocked. So sometimes you don't want to do one too fast or things like that.
Can they get worms through the cow's milk?
Yeah, there's a parasite that'll do that. Yeah, we'll get to that one, okay? Let's come in. So aspirates they get from eating the larvae. Okay? The next one's called tapeworms. Tapeworms generally aren't a big problem in horses. We just see them in their feces. If horses have chronic or heavy infections, it can cause problems in the colon, where the colon gets really scarred up, and the horse might have digestive problems. If they get enough worms in there, it can cause a colic infection. But generally, for the most part, all these parasites don't cause too many problems for adult horses. The next one are called pinworms. Okay. And then pinworms are little small worms, and then what they do is they lay eggs around the penis, and it makes the horse really itchy. So you'll see horses, they'll rub on they're always scratching their butt.
I think over that.
Yeah.
I think people talk about that when it's on the worms.
Yeah. So they'll just get really itchy because the worm lays the eggs on the outside of the penis or associated with the penis. And it's super itchy, and so you'll see horses, they'll rub the hair off their tail head, or their tail head, the hairs will be all broken and fuzzy, you know? And so that's the same thing. They don't cause a lot of health problems, they just cause the hair loss, which is ugly, you know? Like big long flowing things. So pinworms aren't generally a big deal. Okay. The second one is bots. So bots are flies. They look like little bees almost. They'll hover around your horse's legs. Have you ever seen eggs, bot eggs? So they land on their legs. And then they get kind of itchy in the ball of the horse, and so the way the eggs are told to hatch is the horse licks them, and actually the heat from the saliva activates the egg from hatching. So what they do is they lick them because they're itching, and then they swallow them, and they can spend, I think, up to 9 months, 6 to 9 months, I think, inside the horse's stomach, and then they get past the feces. Okay. One way as horse owners you can kind of try to limit that is because we that's probably the one we can't manage through pasture management. If you actually just take a pretty warm rag or spray their legs off with warm water, it'll activate those little eggs to hatch. And they just hatch them out because they're not being swallowed. So these stay warm and I think they can actually make like little cones, and they're supposed to show them off. And then threadworms, that's the one you're referring to. So threadworms are one that's foals can get it from nursing from infected mothers, or they can get it passed through milk. I believe also that they've also discovered that foals can be infected while they're in utero. So if a mare has it and the ones are migrating, that's one that can migrate through the placenta. And then they can get it even from the environment as well. And threadworms also can actually just burrow through the skin. So they don't really have to eat it, they just burrow through the skin and crawl up their leg. So it's kind of creepy, right? So that's kind of the 6 parasites we worry about. And in summary, the early ones we're worried about are large, strong jaws. They're kind of the most, what we call pathogenic, or can cause the most damage. All the other intestinal ones, they tend to not be too serious. Okay? So this little article is a pretty good one. It's called Decoding Dewormers. So the biggest problem we have with dewormers is drug resistance. So you've probably kind of heard that. A lot of the parasites are becoming resistant. And I'll show you this little article to show you which ones they've found a lot of resistance in. And this article is a couple of years old, but it's 2022, so it's not that old, but just probably updated, even a little more updated information. And so the other big challenge we have with dewormers is there's only 3 classes of drugs. So there's only 3 types of drugs that kill parasites. So we don't have a whole lot of options. And so there are specific things we can do to try to manage or limit the use of dewormers with we can do. So some of the terms I'll use, I'm going to use the word anthelmintic, so that means dewormer. So that's what we're trying to prevent is anthelmintic resistance. That's just the overall class in those 3 individual drugs. And so I won't go through this. Well, so the specific drugs there's called I'll probably say this wrong. Benzimidols, okay? And those are things like panicure. Maybe familiar with panicure. That's that class. Okay? Actually, probably a better choice right there. And then we don't use this one typically in this area a lot, but if you heard of pyrantel case or strongyl, so that's a class, and that falls into pyrimidines. Okay? And then macrolitical actinoids, that's the hydromactic classes. And so, in this article, if you ladies follow the link and get online and look at it, this is actually pretty good. It shows you what drug class works best for whatever parasite, and what drug class the parasites are resistant to. So there's some that have higher resistance. We'll go through this real quick. So the benzimidols or panicure label, small strongyls are pretty much resistant to that, according to this study or this article. There are also pretty resistant to the strongyl type, okay? Aspids are the one that affect the baby foals so much, right? Aspids are pretty much resistant to ivermectin. So you'll hear sometimes people talk about like a rotating protocol, right? And we'll address that, but good news is large strongyls, that's the ones that migrate and cause the blood clots, they're pretty much susceptible still to all 3 classes. So that's the one we're really good at. Okay? So there's different ways to decide when to do one. Okay, one of them is to use what's called a fecal egg count. So what it's a test that they actually take a sample of feces from a horse. It requires a certain amount of grams, and then they run a test on it, and they count how many eggs are in there. And then they can identify the eggs. And so the eggs are the number of eggs the horse is shedding helps us determine if we should deworm or not deworm. And the reason is, I mentioned it earlier, we're never going to get to a point where we can get rid of 100% of the eggs. It's just not possible. And it's called natural selection. Okay? So we know that these products, even if there's a population of worms that are susceptible to one of these drugs, and say you give it to our horse, we know that we're not going to kill 100% of them. There's going to be a small percentage of worms that are always going to live. And what that means is we expose them to a drug, they survived it, so they're kind of super going out. And that's how we develop resistance. And so if we keep using the same drug all the time, and all we're going to do is eventually create a very large population, as I said, of resistant members. And that's what's kind of happened over the years. That's why we've seen such high resistance levels. And so horses are classified into low shedders, moderate shedders, and high shedders. Low shedders we tend to not want to give dewormer to because they're just not a big problem. Moderate shedders, it can kind of go either way, and that has to do with how many eggs are shedding in their feces. And high shedders are the ones we really want to focus on. So high shedders in the studies, about 20% of horses are high shedders. And so those are the ones that we really want to focus on treatment on. And those are the ones that are contaminated with pastures or hormones. So shedding rate is one factor we take into account. Age, so we'll talk a little bit about foals. Less than 1 year old, we need to deworm them. Those a lot because they can get the worm infections. Okay. And then as horses age, they get a little more resilient to that. So about up to 5 years old, they're pretty resilient to some of those parasites. And then as horses get old, like senior or geriatric horses, their immune system can be a little weaker, so those horses can turn into high shedders. This article also references the AAEP, so that's the American Association of Equine Practitioners. It's a veterinary organization that sets a lot of standards, and they have some pretty good guidelines. And one of the guidelines they recommend for horses under 12 months old is to actually deworm them every 2 to 3 months of their life until they're a year old. And that's because they're so susceptible to those roundworms. Okay?
So on the babies, you want to use like the strong and the parasite, or those two?
And so really kind of a good way to remember that's 3 months, 6 months, 9 months, 12 months. And then they recommend that horses 2 years and older should receive dewormers 2 to 3 times a year. And this is all kind of hinges on a fecal egg count test, which we'll kind of get into. Okay. And to kind of answer your question, that's what this little chart showed, Andy, that I found. It just really shows you this is the name brand of the drug over here that you're probably most familiar with, and then which ones it affects. Okay? And it even actually gives you kind of some recommendations as when to do, like in spring and fall. It's most commonly recommended. And really that's because in the fall what we want to do is we want to clean our horses out so that they're not shedding a lot of eggs into our pastures and our lots before we go into winter. So we're trying to keep pasture, we call that pasture pressure or pasture load, try to keep that down. So that's why we're using that. So what we do, what's recommended, would be to do a fecal egg count, which we talked about. Okay, so what we do is send in this certain amount of feces, the lab tells us, okay, there's so many eggs in that sample. Okay? And then there's a little chart or conversion that you follow and classifies them into low, moderate, or high. Okay? And then what we do, we give them some dewormer if they decide to. And then after we give them dewormer, we run the same test again. So run another fecal egg count, and then we compare how many we started with and how many we killed.
How long do you wait between the two?
I believe it's a month. And so that's called a fecal egg count reduction test. And this is kind of the gold standard of how we manage parasite resistance. So there's this term, it's called refugia, like kind of like refuge, but refugia. And I explained it a minute ago, but that's where we want to leave a certain number of individuals that are susceptible to our drugs. We don't want to, and we want those worms to then breed and create the population that we can kill. Or if we give lots of drugs, and then we only have like a small percentage live, then those ones pass their super genes on and they become resistant. Right? So that's called refugia. It's kind of a theory idea, but that's how we try to manage it, is through fecal egg count reduction. And I'll be honest with you, fecal egg counts are cheap. I mean, they're really cheap. And, people that have a lot of horses, I wish they would really take this into consideration, because it can save you a lot of problems down the road. Once you start getting resistant worms in your pastures and your herds, it's tough to get some problems with them, especially for farmers. But it gives numbers. It gives some numbers and percentages for certain drug classes. So if the worms don't drop enough, then it's classified as resistant. And then there's parameters you take, like maybe try another drug. So a couple take home points from this. We talked about resistance. Do you have any questions on that? Sorry, I'm not throwing a lot of things at you. So really, just the idea of resistance. We don't want to create that, right? And the way we can manage that is through people. And okay. So the next step is to, or the next option to manage parasites is to do that through pasture management. And it's not a whole lot of science in it, honestly. People probably mostly do the things that I'm going to talk about. There's one is just clean up manure. Okay? So if you clean up piles of manure within 24 to 48 hours after they're left, then that'll reduce the amount of worms in the big shed that you're buying. Because it can take about 72 hours for those worms to hatch in the manure and crawl out. And so clean those manure piles up. The other thing is to, if you have like a pasture or a lot, is to harrow the field when it's really hot and dry. So we live in Utah, so we have a luxury. Back east, it's a little harder. But when it's really hot and dry outside, if you harrow the field and break those little balls up, then the little worms struggle up and down. And then the third way, or another way, is kind of grazing them. So we talked about the dry rot. Probably the best thing to do is to feed them off the ground. That has its pros and cons, because that can mess with their teeth wearing inappropriately, but in the pasture setting, some of the recommendations are not to overgraze is a big problem. Okay, so we want to leave grass blades. So this is going to sound funny when you talk, because this article is written by a professor in Pennsylvania, so they don't know what things to do. They have lots of grass, but the standard recommendation is to leave 3 inches of stone. Okay? And that's because the horse isn't grazing clear onto the dirt and picking up more parasites. So it's just farther and farther. So what the parasite does is it crawls all the way out to the end of the grass blade, and sits in the weeds. And so the shorter the grass, the less it has to climb, right? So that's one recommendation. The other is deworm in the fall. We don't put a heavy pasture load, heavy parasite load into our pastures or in the winter.
So they'll just sit and run all the time until it's hot.
Yeah. So what they do is through their life cycle, they hatch, turn into these little worms, and they burrow down in the ground. And that's how they get through the winter. Some of them can create those cysts and survive winter. And then when it gets warm, they're triggered to hatch and activate and crawl out. Yeah, they're pretty hard to do. And then The other thing on a grazing setting is to actually graze with other species, so like maybe sheep or cows. So for cross grazing, it's the parasites that live in the sheep, per se, they don't really affect the cow or the horse. The same with the cows, but all species kind of have their own parasites, if you will. And so if we think about that, the pasture environment, all the parasites are kind of competing, right? So they're out competing each other. So that actually lowers the parasite load in theory, and it lowers the parasite load for our horses. And then the other recommendation is to, if you can, if you have enough pasture, or I guess enough dry lot, it would work there too, would be to actually rotate through the season. Right? So rotate grazing allotments. And even if you can, it would be a sacrifice, they call it sacrifice lots. So don't even graze it for a year. So that gives it time to, for the ones that kind of die off, the ones that are being the parasite loads to diminish. Those are really the biggest things with pasture. There's not really like too many sprays or things like that you can really do to keep it going. Other than that, that's pretty much it. Any questions?
I answered all of my questions, but that's all you answered everything. I didn't even think.
So I didn't get really specific on the deworming protocols. We could probably put out a little chart or something. But really, I think if you want to do the best you can do for your horse, would be to start with a fecal egg count. It's very simple. All you have to do is collect a pretty good handful of manure, put it in a little bag, and do the bag. And the fresher the better. Then we just send it off, and then they send us a report, and we'll work out a plan.
Are there some that are, like if you don't get fecal, are there some worms that are better to run for in the spring versus the fall?
So
So are there some worms that are better to do in for in the fall versus spring?
I'm going to say yes, kind of a yes and no. Really it should start with a fecal egg count, because what that does is it helps us identify some of the worms that the horse has. Okay. So kind of where to start. Really answer that, right? So if we identify what's in there, that gives us a place to start.
Gotcha. That was my last question.
Okay? Well, thanks for coming out.
Thank you for the information.
I hope you learned something.